Pain relief that doesn't involve pills, injections, or surgery. More and more people want to find alternative healing techniques to avoid the cost and side effects of conventional medicine.
Although there's very little research to indicate alternative medicine actually helps, it's more popular than ever. Eyewitness News reporter Charlie Cooper shows us some of the options right here in San Antonio.
You can skip the trip to the doctor's office and take a dip instead.
So it's the best kind of therapy.
Many people swear by it. Stepping into a pot of water heated to 94 degrees and filled with 1,200 pounds of Epsom salt. It might sound a little different, but George Frank Garcia says it's a remedy that's kept him afloat for a while now.
I learned that it could help not only de-stress, but it could help with my sciatica. I've had back pain since I was a lot younger due to a car accident I had when I was a kid.
And unlike the doctor's office, here at Float, there's no sound, no touch, no distractions. This appointment strips the body of all senses as you drift across water for an hour.
So you float with zero effort, so you're able to completely relax all of your muscles.
Jeremy Jacob, owner of Float San Antonio, says studies have shown that floating allows the mind and nervous system to rest in a deep state. It's said to help with chronic pain, stress relief, anxiety, and body regeneration.
My pain is very reoccurring. When I went to the chiropractor, they would pop my back, stretch me out, and do stretches with my body and to help alleviate the pain. But with Float, there's no gravity on your body, so it helps expand your spine.
But what's the difference between float therapy and just putting salt water in a bathtub and sitting in it?
Water temperature, the buoyancy of the water. We even soundproofed our rooms so that you don't hear audible distractions. And you know, they've measured lower cortisol levels from floating in some studies.
Jacob says floating isn't a cure, but a temporary pain reliever. And while some flock to floating, another therapy option San Antonians are trying is virtually the complete opposite.
Cryotherapy is a cold therapy. What it is, it's an upright chamber that you stand in.
A capsule you stand in for 3 minutes at negative 230 degrees. Yup, it's cold. And Monique Davila, owner of Alamo Cryo, says
Literally cool.
the body essentially freezes.
The blood rushes to the core to protect the body. There's a reoxygenation that's happening while you're in the unit during those 3 minutes. When you step out, you've got reoxygenated blood that flows back out to the body.
Then the blood warms the body, Davila says, and flows to areas that are inflamed or sore. Cryo is used for everything from sleep disorders and fibromyalgia to psoriasis and arthritis.
It's not a cure, but what it is, it does provide a relief, a sense of relief for folks that experience that pain and inflammation.
What sets cryo apart from, say, an ice bath? Davila says effective ice baths usually range from 15 to 20 minutes long.
Where this is bearable in the sense that it's 3 minutes dry and you're in and out, and your body starts to warm up right away, where you have mobility immediately coming out of the unit, versus an ice bath, you don't have that mobility.
No matter what kind of alternative healing people are into, most who choose that over a trip to the doctors say it provides at the very least a sense of calm and helps bring their bodies back to center. But of course, we always recommend you ask your doctor first if either of these alternatives is safe for you. In the studio, Charlie Cooper, KENS 5, Eyewitness News.